Good morning, everybody. Welcome to Brookfield Zoo's Bringing the Zoo to You. I'm Dr. Mike Adkisson, and we are here today inside of our Australia house here at Brookfield Zoo. And we've got our veterinary team working with our animal care team today, and we're taking a look at Cambora, one of our wombats. So we thought we would bring you kind of behind the scenes for this veterinary exam. We show you a lot of times, we show you animal exams taking place at the hospital. But we try anytime we can to take a look at the animals in their normal habitats where we're able to work on them sometimes awake without the need for anesthesia. So Dr. Katie Delk, one of our veterinarians, is taking a look at Cambora here, and she's got a couple of little small areas of hair loss on her ears. We call that alopecia, is the medical term for that hair loss. And what we're doing today is just trying to figure out the cause for that hair loss and collecting some samples from it. So you can see Dr. Delk here is getting a little sample of the hair on the ear there associated with that lesion, and we're going to actually set up some cultures off of that hair to try and identify the organism that may be responsible for this hair loss. It's always great when we can work with an animal in an enclosure like this. It's a very calm and relaxing type of situation for the animal. You can see Cambora is not too bothered by what's taking place here. She's enjoying the food pan in front of her and some extra treats this morning. Diane's also got Mia, one of our other wombats, here in the habitat, and just is basically giving her some treat food items to keep her occupied and make sure that she doesn't interfere with what Dr. Delk is doing over here with Cambora. Wombats are pretty docile animals, so they're fairly easy to work with, and you can see that Cambora is really tolerating Dr. Delk taking a look here pretty favorably. In addition to taking these hair samples, we're also going to try and take a little scraping of the skin in that area to see if there's any noted changes within the skin that may be explanatory for what's going on with these lesions as well. One of our big differentials right now for what's going on here is an organism that we call dermatophytosis, which is more commonly known as ringworm, which is a very common disease that affects people, domestic animals, and a wide variety of other animals. And it's actually not a worm, it's actually a fungal organism that's responsible for this, and it's just a little localized fungal infection. And what we're doing is collecting some samples off of this that we'll be able to set up in culture, and if we're able to culture that dermatophyte organism off of the culture, then we'll know for sure that's what we're dealing with. And it's fairly easily treated with just some topical ointments or some oral medications that the animal will eat. And you can see Cambora is a very cooperative patient here, so if this does turn out to be the positive organism resulting in these lesions on her ears, it will be very easy for our care staff to put some of that ointment on her ears a couple times a day to clear up this infection pretty quickly. Wombats are really pretty unique animals. The ones we have here at the zoo are southern hairy-nosed wombats. We have two of them, Cambora and Mia. So Cambora is the one that we're taking a look at right now, and Mia is actually her daughter, and you can see that she's a little bit smaller still. She's about 2 years old, so she's still got a little bit of growth to do. You can see Mia there really enjoying the food dish she's got in front of her. They're mostly herbivorous animal that eats a variety of vegetables, roots, other plant materials, and they're from Australia, obviously, since we're here in the Australia house at the zoo. They're nocturnal animal, active kind of dawn, dusk, and overnight, and a great burrowing animal. They dig really expansive burrows underground that can be sometimes several hundred feet long, and they've got really powerful back legs and sharp claws that aid them in doing that digging and making those burrows underground. One of the unique features about them that is associated with that burrowing activity is that their pouch is actually backwards facing. So when they're digging, they don't fill up their pouch with dirt as they're digging their burrows. They are a pouched mammal, or a marsupial, just like kangaroos and wallabies and a variety of other Australian mammals. And they give birth to a very underdeveloped infant that makes its way into that pouch, and then will finish its development in that pouch, just like a kangaroo that most of us are pretty accustomed to seeing with a pouched joey inside.
So if Cambora has ringworm, will Mia need treatment too?
It's possible. Mia does cooperate very well with treatments as well. You can see she's very calm, and Diane's able to get really close to her and would be able to work with her no problem if we do need to get some sort of treatment on her. Right now we're not really seeing any significant lesions on her, but we would really take a good look if we were to diagnose this as the cause. It's a pretty contagious organism that can spread pretty easily from one animal to another, or from one animal to a person. You'll see Dr. Delk has gloves on to make sure that it doesn't jump from Cambora to her hands. But it's a very common organism and very easily treatable. Most of us probably at some point in our life have either had it ourselves or know of somebody else that has had it. Or the same thing with our pets, dogs and cats. It's a pretty common organism that shows up periodically on dogs. It often comes in on some sort of substrate or substance, so things like the hay that we give these guys for bedding, or the straw that we've got here, would be common sources where these sorts of organisms can make their way onto an animal and establish a little superficial infection, or just a little infection of the skin area.
How often do wombats get health checks?
So our wombats get a kind of what we look at is two different kinds of health checks. So they get these types of health checks where a veterinarian looks at them up close anytime there's a concern. They're very cooperative patients, so a lot of the exams we can do with them awake right here in the building, in this sort of house call setting, if you want to call it. But they do also get more in-depth routine exams on an every 2-year basis, where they would be under general anesthesia for those exams, and those are done over at our animal hospital, and that allows us to do things like blood collection, diagnostic imaging, and a variety of other tests to make sure that all of their internal organs are functioning appropriately, and that there's no other underlying health concerns that may not be outwardly visible on a wake exam like what's happening today.
How often does your staff make these house calls?
So we've got somebody out in the park every day doing either primary exams like what's taking place today to diagnose a problem or a concern, or to do rechecks on other animals that may have conditions that we're keeping a close eye on. We try and do as much stuff out in the normal enclosures with the animals as possible. It really is a nice way for the animals to not have to be transported over to the hospital, and to just provide the least amount of disruption to their daily routines as possible.
Are there any animals who only get house checks? House calls?
Yeah, so there's certainly animals that we are not able to transport over to our animal hospital, but those are really only a few animals here at the zoo, and it's really only when we're talking about the biggest patients that we work with. So things like our rhinoceros or our giraffe, some of our really big animals, we only will work with them in their normal habitats. If we need to do an anesthetized exam on those animals, we would just do the anesthesia right there in their normal habitat area. You've probably seen videos before on some of our animals like Layla. Layla would be a great example, where when we do have to put her under anesthesia, we're doing that in her normal habitat, just because she would be so hard to transport over to the hospital.
How do you remember how to treat such a variety of animals?
That's a great question. That's one of the challenges of being a zoo and wildlife veterinarian, is that we work with so many different species and deal with so many different conditions and potential diseases within those animals, that it is a lot to keep track of. Our veterinarians here at the zoo are board certified specialists in zoological medicine, so they've all completed additional training and education beyond veterinary school that specializes them in zoo and wildlife medicine. The same way that veterinarians or physicians may specialize in something like neurology or cardiology and undertake additional training in those specialties, there's a specialty devoted just to zoo and wildlife species. You can see Ivana down here. Ivana's a veterinary student that is spending some time with us. So we have rotations for senior veterinary students who are interested in pursuing careers in zoological medicine. Many of them then go on after veterinary school to complete an internship or veterinary residency to pursue a career in full-time zoological medicine. And that's usually an additional 3 to 4 years worth of schooling beyond veterinary school to learn the nuances of working with all these different animals that we help here at the zoo.
How many students do you usually get every year?
We, on average, about 15 to 20 different students that we rotate through our veterinary education programs on an annual basis. We've got a really active program here at the Chicago Zoological Society for Veterinary Education. It's one of the things that we put a lot of focus and energy into. In addition to the senior veterinary students, we do also take veterinary technician interns, veterinary technicians or veterinary nurses. In their final year of education and training, we've got a program set up for them to also gain some experience in non-domestic animals. And then we've got our residency program, which has 3 different residents enrolled within that program. It's a partnership with the University of Illinois College of Veterinary Medicine and the Shed Aquarium, and they spend time here, in addition to the other facilities, learning those really advanced skill sets to pursue a full-time career in zoo and wildlife medicine.
Now, when animals have to have medications, we did learn last week that the vet techs prepare all the meds. Who actually administers them in?
Yeah, so that's our animal care staff are generally the people responsible for administering any sort of medication to the animals on a daily basis. So that is really a challenge sometimes, and it's something that we work very closely with them to try and find the best formulation or the best way to present that medication, the best way to flavor it or food items to hide it in. But they are incredibly good at what they do. I can't say enough good things about our animal care staff and their persistence in finding creative solutions to get medications into animals when we need them to.
Who's your favorite patient to treat in their own home?
Favorite patient to treat in their own home? That's always a tough question to answer because I really do love all of the different animals that we've got here at the zoo, and it's always so hard to kind of pick a favorite. I would have to say these guys right here are some of everybody's favorites, I think, to work with because they are just so calm and such cooperative patients when we do need to come do a house call. They're usually pretty content to see us and pretty easy to work with.
Let's see, hold on. What types of food are they eating right now?
So they've got a variety of vegetables down there. They've got some lettuce leaves. They've got some dry chow there, so we can see some different biscuit type food items that are just a prepared diet for them. There's a few peanuts in there, some treat items, some carrots. Given that we're working with them today and trying to keep them here at the food bowl to allow the veterinary staff to be able to get up close and work on them, it's not exactly their normal diet. They've got some extra treats there to make it extra appealing, but in general, in the wild, these guys would be eating a variety of really fibrous and plant material. So thank you so much for joining us today while we bring the zoo to you. We always love sharing with you what we do behind the scenes from an animal care and animal health standpoint. We hope you enjoyed getting a chance to see the wombats up close today where our veterinary staff was taking a look at them, and we'll see you tomorrow on bringing the zoo to you.